You're welcome here once again. This is Dr. Bimbalo Nifadi, and in this lesson, I'll be answering some questions. I'll be dealing with common concern and frequently asked questions. And this is Diabetes and Hypertension Intervention Program, but we'll focus on questions on diabetes for this particular presentation. And the even for diabetes, there are different categories of questions that are being asked. So what this particular lesson will deal with is the questions that borders on best time to check blood sugar to ascertain progress and concern on changing values. For instance, when people come on a program, they begin to see improvement. Maybe today they get 80 uh, milligram per dl, then tomorrow they get 85. Some people are apprehensive about that. Be like, I improved yesterday. I got 80. Today I'm getting 85. Please, what's going on? What's wrong with me? What can I do? Blah blah blah. And I've had somebody that was improving significantly, and from two medications, off medications completely, and she came down to normal. That's between 70 to 100 milligram per dl, and at the time she got 102 and she began to panic what's going on. And interestingly again, she got, let's say, 80 today, I mean 87, sorry, in for fasting blood sugar. Then in the afternoon she got about for random blood sugar she got about 100 and, let's say, 10, and she began to panic. I got it in the morning, I'm getting 110 now, which is a perfect number, perfectly normal for random blood sugar. And such, the person was all panicking. So that you can be well informed, I've gathered together frequently asked questions like this, and I'm be answering them here. And this is a very extensive and knowledge base of questions, because our program has featured at least 10,000 people, and we have unique question and answer section, and then people ask a lot of questions and much more. This question focuses on people who are on the premium program, but even if you're not on the premium program, these questions and answer will still benefit you. So question one is, please doctor, when is the best time to check the sugar level? Is it before meal in the morning or after meal, so that I can know if I'm making progress or not? So this is one of the participants on the premium program. Then the second question is likely it as well. Can one check it in the morning and 2 hours after dinner? If yes, is it to be done daily? So the answer now, check your blood sugar in the morning before eating, drinking, or engaging in daily activities, and 2 hours after first meal, and do this 2 to 3 times a day, 2 to 3 times a week. So you check in the morning before you eat or drink anything, that's fasting blood sugar, and before you engage in your daily activities as well, because that changes a lot of things. And once you know the first value, then do the second one as well. That's 2 hours after your first meal. Then you should do this 2 to 3 times in a week. You can also check at night or randomly. So by the time you do this 2 to 3 times in a week, it will get to a time when you begin to see the pattern, and then you can now space it a little more. Then the third question, good evening doctor, I want to ask if random blood sugar of 140 is good. That's perfect. Random blood sugar is blood sugar that is done randomly regardless of when you last ate. Then the number is 79 to 160 milligram per day. So the person has 140 milligram per day, which is normal. That corresponds to 4.8 to 8.9 millimole per liter. So like the first example I gave, if somebody have 80, or you have between 70 to 99 in the morning, which is within the normal range, then you now have 140 later during the day, and the person begins to panic. They say my blood sugar is going up. It used to be 80 before, now it was 80 in the morning, now it's 140. Blood sugar is it's a continuous thing. It goes up and down, depending on the time of the day and depending on just depending on the time of the day and depending on what you have eaten, and there is so many explanation behind that that we can do for the whole day. So just know and understand that the value for that which you get in the morning is not the same in fasting blood sugar. The normal value is not the same with the normal for 2 hours after you have eaten. It's not the same for random blood sugar, and the lowest is usually the fasting blood sugar in terms of the normal value. So there is a video on that discusses about value, so make sure you watch it and listen to everything there. Then question 4, doc, my random a minute ago was 88 milligram per dl. I feel faint. So this usually happens when you have persistently have a high blood sugar, and at the end of the day it now comes down to normal. So some of the people in our program have serious issue before with their blood sugar. When they come on the program, it comes to normal. So sometimes when it's like this, your body has been used to a very high blood sugar, and it just comes down, and then you begin to feel like you want to faint, like the person said. What you need to do is just relax, drink water. Even sometimes you exercise at this point, it doesn't even harm you as well, but relax, drink water, or at most choose a meal from the main menu of the meal plan. So, and remember, random of 79 to 160 is still normal, and this is 88, which is still normal. So if you feel faint, you can just choose something from the meal plan, the main menu of the meal plan, and eat, relax, and then you're not going to die on this. So good morning, doctor. Check my blood sugar this morning and it's 375. Hope it's okay because I'm on once a day medication. This is perfect and it's okay. So when you begin to get 75, depending on the once a day medication the person is on, so this is an indication that the person will soon probably the dosage of the medication will be reduced, then later on the medication will be completely taken off. But 75 is perfectly okay, and it's an indication that you are approaching the time for the medications to be lowered or for it to be completely taken off, given the same condition, and then given that you are still following the program. So yeah, so this is the answer. Fasting blood sugar done 8 to 12 hours from last meal. Normal is 70 to 99 milligram per dl, which corresponds to 3.9 to 5.5 millimole per liter. So the 6th question. Good evening, doctor. We are still in the program, but I want to tell you some of my observation. The day that you said beans and in the afternoon choose me, if I eat beans and in the afternoon I eat plantain, the next morning my sugar level will go up. And nowadays I don't like to eat in the morning again because again, will there be any problem? Now the first and foremost thing is, if you are not tolerating any meal well and your blood sugar is going up, you can actually watch that meal, know where you are buying it from, especially if it is recommended, and be sure that you are buying what is original and what is for something like beans. I don't know if there is fake beans anyway, but talk about plantain. I don't know if it is plantain flour. Some people can do imitation. I don't know if the plantain the person is eating is ripe plantain. That is different from the unripe one, and for some time of the program we don't recommend that as well. So many factors, and again another thing is I don't know what the person mean by saying the blood sugar level will go up. Like I've explained before, sometimes it could still even be within the normal, but maybe because the person was having 80 at a time and now it goes up to 92 and the person is now panics and say it has gone up. So that could still be perfectly normal. I'll still answer. I showed the presentation for the answer anyway. And nowadays I don't like eating in the morning again. Would there be any problem? No, there won't be any problem. You don't have to eat in the morning, but whatever you be eating in the other part of the day, make sure it is balanced. Make sure it is balanced. That is the essential thing. Have a balanced meal. Don't just eat what is not balanced, and balanced means you follow the meal plan anyway and look into eat nuts, vegetables and your meal and the rest like that. Today I ate basmati rice in the afternoon. Around 6 p.m. I measured my blood sugar level. It is 105. I want to know if it is okay. This morning it was 99. This is exactly what I was talking about. Thanks. So random blood sugar of 105 milligram per dl is okay, because this person measured the sugar around 6 p.m. and the person wants to know if it is okay because in the morning it was 99. Now this even shows a remarkable improvement, because the random blood sugar for diabetic patient is allowed for it to be up to 180, but this person has 105. But because this person is comparing it with what he or she has in the morning, the person is thinking that probably is it okay or not. This person should be jubilating, jumping and dancing for this progress. So my answer to the question again is blood sugar can go up. The important thing is to be within the normal range, which I've talked about. And it's okay to skip meal, but you should not skip meal if you are to take medication, especially anti-diabetic medication, because it can cause hypoglycemia and it will cause serious problems. So you don't take anti-glycemic anti-diabetic medication on insulin on empty stomach. Please note that very well. But let's say you have taken your medication in the morning and you just want to skip your afternoon meal. That one doesn't mean anything. Or possibly you are taking medication once in a day and decide to be using it in the evening. That's equally perfect too. So random blood sugar of 105 milligram per dl is okay. So another question: good morning doc, 2 hours after eating yesterday I checked my blood sugar, it was 107. I was so happy, but this morning my fasting blood sugar was 129. What could be responsible for this? I'm the first option, and yesterday was my feasting day. Thanks a lot and God bless you. You have to be on the program and to be participating in a retreat to understand what the person meant by feasting day. But now let's go back to this. Blood sugar was initially 107 and the person was happy. Then 129. Now there is a problem called insulin resistance, and that's a problem that is you have in diabetes. So my answer here is 129 milligram per day is still within the official recommended of fasting blood sugar for a non-diabetic. But our goal is not to be within that recommendation. Our goal is to reverse diabetes so that you will be within the normal range. But understand that obviously this person has an improvement. Even that 107 is an improvement of what the person used to be before the person joined the program. And now that the person has joined this program, the person now has 107 a day, the following day 129. This is perfect improvement, let me put it that way. Even though this is still not our goal, but this is a lot of improvement for you. So you are to compare your progress, measure your progress by what it used to be. So long as you are still doing better than what you started and you are still keeping to the program, over time your value will become constant. So when you're on this program, your value will be consistent most of the time, but it's not going to be a single value. Like somebody might say, oh, I have 85 yesterday, now I'm having 90, I'm worried. Blood sugar is not measured in one isolated value. It's always in range. The number for fasting blood sugar is 70 to 99 milligram per dl. So you can beat 72 today and you can be 99 tomorrow. You are still within the normal range. And quite interesting again, like I said here, that the official recommendation of fasting blood sugar for a non-diabetic, when you have I think 130, sorry. So when you have improved like this person on this program, it is not likely that you will jump to over 130 or you will jump to 200 or what have you, so long as the condition, everything is constant. So in that case, what you should do is, so long as you are still within this, understand that the problem of insulin resistance is being resolved gradually, and until you are able to get on top of this, there might be some fluctuation, but it's still going to be within what is acceptable. Once you have anything between, given the same condition, let's say you are within the same condition and you have 107 now, and again you will end up having, say, something between 107 to 130 to 150, given the same condition, don't panic, just continue the program and make sure you stay true to it and stay true to the condition that has helped you before. So happy new Wednesday doc. My fasting blood sugar value at home is always higher than at the lab within a gap of 30 minutes. The other day I had 6.5 at home, but 5.0 and 4.1 in two different labs. Any explanation, please? So the difference and the time difference and activity from one place to the other could account for the difference this person is saying. This could make it to either be higher or even lower. So time difference, the person this is taken at least 30 minutes apart, and the person had to move down to the place. That's activity already. So that's one. 4.0, 5.0, 6.5. This is still fair. This is still okay. Let me put it that way. This is still, so long as you are making improvement, and it's not like it's getting worse than what it used to be, but the other way around. So the second explanation is result varies for different lab also. So knowing the normal value for the lab when it comes to investigation is important, but the most important thing is that you usually want to consider the result you got in the lab, all things being equal. All things being equal, that they are not using the same device you are using, and all things being equal, that activities are not coming between that can alter what the result will be. Then the question 9. Good evening, doctor. I've been following the program. My sugar level has been consistently dropping. The last time I checked it was 96, but today it is 99. I don't know what caused that. You see, this is not even anything to panic about. There is no difference between 96 and 99 as far as blood sugar measurement is concerned. Even if you finish it now and do it the second time, it's not going to give you the same value, but the range is what matters. So 70 to 99, that's still within the normal range. And if you have anything between 100 to 150, so long as you are still following the program and you're on the same condition, you don't need to panic. Now, people tend to want a quick result because most of the people that comes on our program get the result quickly. And when people are talking about it, other people are challenged and they are worried. Just know that your peculiarity differs. So measure your progress with yourself. One. Number two, don't break the rule. When we say don't stop medication abruptly, don't do that. Don't stop medication abruptly. We have a consulting platform available, and that's www.smartmedicalprograms.com/consult, where we can do a thorough work and thorough question and answer. When you use that opportunity, that's not free anyway. But at the same time as well, you can still use a quick support, which is on the WhatsApp page. We've always answered people that ask questions on that page. And if you now need more, and then we know that what you need is not what we can resolve just by that quick support, then we'll direct you appropriately. So that's what it should be. Don't panic. Don't between 96 and even, let's say, it gets down to 120. There is nothing much different. But I think I know this particular person that sent this, and the person, I think, has, I don't know, maybe prediabetes. It was not as good as this when the person started, but this is better, rough now. So the overall thing is we should still just continue, and depending on how severe your case is when you come on the program, measure improvement with yourself. Some people within a month they are off medication, some people within 3 months, some people up to 6 months, some people maybe up to a year. The important thing is that you embrace this new change in lifestyle, because it is not anything difficult to go by. Then the second thing is that you see progress. If you are not seeing progress, shout out. But this has really been the case. It's either people are seeing progress and they alter it by themselves by getting off medication abruptly, taking things into their hand and messing up some progress, but when they come around again, they see the same improvement and then they are back on track. So please note that. So this is my answer, which I've explained elaborately. So that's where we'll end for this particular. This represents a particular set of questions that people commonly ask. Possibly we have about 100, 200 or more of these, but I've screened this out to answer whatever angle that relates to this. So for consultation, please visit www.smartmedicalprograms.com/consult, and if you are watching this and you are yet to join the premium program, please visit www.smartmedicalprograms.com/premium and join us immediately. Also subscribe to my YouTube channel to get more videos and more helpful videos like this. Thank you.